Okay, I've started the recording. Christine's not here to remind me. But so let me repeat that real quick for our friends since I just turned the record button on. There's not been a whole lot of movement on the budget at this time. They do continue to have discussions. Private discussions in the chambers, etc. They typically do those on non-voting days, but I'll talk more about that here in a second. But the Independent Fiscal Office of the Commonwealth did recently release a budget brief as far as DHS and Medicaid funding goes at the state level, based on what's happening at the federal level. The massive reform bill swept through the House. Still has not been officially voted on by the Senate. I haven't looked for some time to see if it's even been introduced to the Senate yet. So hopefully, fingers crossed, that's one of those things that dies. Or they at least get enough pushback that we have to start over again. But that budget brief that included in the agenda is based off of those potential federal cuts for Medicaid, and how the state may or may not have to make up for those, in insuring individuals in the Commonwealth. So there's that. There's more information about what's happening federally here in a little bit. But there, if you're in the NAMI sphere and you're receiving Stephanie's emails, she does one every Friday. And again, I can talk more about that here in a second. So, but yeah, that's what's happening with the budget right now, at the state level. And again, the overall in general, we're probably not going to know a whole lot until things happen at the federal level, just because of how the cards might fall budget wise, to see what federal funding that might be getting cut out of the state budget and how the state may or may not be able to make up for that. There is a lot of money in the rainy day fund, but of course, there are individuals who don't think that this is necessarily an emergency and aren't ready to touch that right now. So, um, anybody have any questions about that before I move on?
Hey, Nikki.
No, okay. So,
Nikki, can you hear me?
sauce update. A lot of you. Oh, Lynn, I'm sorry, I didn't see you waving your hand.
Can you hear me?
I can't hear you. No.
Okay. Wow.
Lynn, I could hear you.
I hear you,
I think
Lynn.
it's Nikki.
Okay.
Everybody else hears you.
Kim Everett, can you hear me? Oh, geez, Nikki. Let me put. But
How come others of us can
I
hear
can't hear
you and
because
not
my
Nikki?
volume's down. Jesus.
Oh, there we go.
Monday on a Tuesday. My bad, friends.
Okay, good.
Okay,
can you
now
hear
I
me
can hear
now?
you. Oh my God.
Righty. Okay. We were worried about you earlier, so this is great. This is a really dumb question, but the 20 million that the governor had put in the budget for behavioral health, which was the follow-up to the first 20 million he put in and promising a third 20 million. You haven't heard anything about that being jeopardized, have you? Yeah, we haven't either. So I just wondered. Okay.
I haven't. I'll say too, it's been an eerily quiet last couple weeks, in general.
Hey, it's Lori. I recently heard a report from our CPA that basically they're thinking everything is in jeopardy, and they're saying that possibly what they call a bifurcated budget might be passed, and then like a real budget in September,
That's
because of what's going on with the feds.
I did hear that. And there's some kind of, lots of folks are saying no, that we don't want to do that, because we don't want to have to come back again. But yeah, that's exactly what I've heard, Lori. It's that in general, people feel like everything's but I just wondered if that was targeted, if anyone had heard that to be a specific line item that was targeted. Hey, thanks, Lori. Thanks, Nikki.
Yes, thank you, Lori. Okay. So now that I can hear everyone and everyone can hear me, I think. Kim says I'm a little low, so I do apologize for that. I don't know how to fix that. Oh, well, I'll just yell at my computer. I got no problem getting loud. So, next on there is the OMSAS Bulletin. I sent that as an attachment. For those of you who do subscribe to the OMSAS listserv, I'm sure you've seen the bulletin issuing new 302 guidance, uniform forms and documentation that is to be implemented all across the state. Then, due to stakeholder feedback, we got another email the following week pausing that bulletin for 90 days in order to gather stakeholder feedback. So there's a few critical fields that advocates feel are missing. In particular for police, I believe it was like box 3, if I'm not mistaken, or something about that is different. And I apologize if I'm misspeaking, but I'm pretty sure that was one of the bigger concerns. But there's a process to offer feedback if you're interested in doing so, based on the new uniform form that was issued. There's an RA account that's going to be taking again stakeholder feedback and either hopefully applying that to what's already been issued. So that process, again, they're going to be taking stakeholder feedback for 30 days, and then they'll update it if necessary and go from there. But it's been paused for 90 days in the meantime. Does anybody have any questions about that? Okay. So legislation, there's 8 voting days before the summer break. There is one non-voting day next week. And again, that's usually when they hold their discussions, not necessarily off the record, but not like a sunshine hearing type process. So that's happening next week. 8 days left for the House and the Senate. They'll continue to meet through the 30th, and then they break for the summer break. And we talked about the bifurcated budget. They'll come back to work at the beginning of September. So on that note, now is a good time to visit your representatives and senators, as they'll be in their home districts. So it's a lot less weight for you to lift if you're not having to drive all the way out to Harrisburg to do so. If at any time you schedule an appointment with your senator representative and you need talking points or wonder what you should be discussing with them, please feel free to reach out to me. It's a busy time of year, but I promise I will get back to you. I promise I will. Kim, go ahead.
So, Nikki, it's a question more than anything. You know, we went to Harrisburg just 2 weeks ago, right? And with the Bucksmont can. And what I heard very clearly from the legislators is, what do you want? Like, we know mental health is a problem. And besides the Medicaid situation, because that's not at a state level problem, right? I mean, it might be, but anyway, regardless, if we were to pick 2 things, besides the obvious of funding, right? Let's just take funding off the board because everybody wants funding. What are the 2 things that you think, NAMI, like we look at all these bills, if you had to prioritize 2 of them, can you tell me what you would pick?
988 and the crisis continuum, and continuing to build that out, and anything.
So is there already proposed legislation around those that you could send to me and tell me that we should be supporting, stuff that's already been introduced?
Yes. I have a NAMI legislative priorities document, and I apologize if that did not make it to you before you guys went. I had sent it out to who I thought it was a good contact, and maybe it wasn't. Maybe that person wasn't. So I do apologize for that.
No, there's no apology needed at all.
Yeah.
We had a list, right? And I'm looking at the bed board, and I'm looking at comprehensive care, or whatever that collaborative care model. Like there's good legislation out there, and we attached that to our priority. So I think we did use that. But what I heard from them is pick 1, 2 at the most. So I'm curious what NAMI, if you were forced into a corner, would say, what are our top 2 things that you think would make an impact and we can actually get legislators to pass. So I know I'm kind of putting you on the spot, but I want to try to really focus and get them to do something.
So as far as the workforce shortage goes, because that's one of our legislative priorities, I would say the bill that looks at the social work licensure compact. That's going to be huge. I know that's a barrier for lots of individuals because every time, and I have I'm a social worker myself. I'm not clinical, but I haven't taken my license exam yet because first of all, every time you take it, it's a lot of money, and second of all, it's a lot of money, period. Especially if I were to get licensed in Ohio and Pennsylvania, like that's at least $500, if not more. So having people who are licensed in another state be able to practice in Pennsylvania as well, that's going to go a long way for I think solving some of the workforce shortage issues, especially when you get into more rural communities up on the New York border that are struggling to fill those roles. If the individuals in New York can come down or like offer telehealth in Pennsylvania, again, it's going to go a long way. And Pennsylvania is it's such a border state. There's like what 7 other states that border Pennsylvania. So I have a feeling that that's going to go a long way to solving the workforce shortage issues and remove a big barrier for care for a lot of people, especially as far as the telehealth stuff goes. And so that would be my number one. The 988 and the crisis continuum thing is so sticky because there's so many different pieces of legislation that support that. So to nail down one, we don't have a 988 fee on the table just yet. That would be on my wish list. That would be my number one wish list to get a 988 fee passed. But again, the legislation hasn't even been introduced yet again this session. So I'll say the social work compact licensure thing for now, for sure. Yes. I would have to think of a second one.
Okay. You can, I mean, I don't disappear. You can tell me later, and I totally put you on the spot. But I just felt like they were putting us on the spot, like to some degree, right? They're like, if you had to pick one thing, and we were there talking about both housing and mental health. Of course, they are connected and all that, right? But I don't want to waste too much of your meeting. And I couldn't answer. And I'm frustrated with myself that I couldn't answer, I guess, if that makes sense. So I'm like, I'm asking you because you're certainly more of the expert in this than me. So I get it. Just let me know what you think.
No worries. Christine, go ahead.
Do you have I remember we had that like handout for that bill. Is that on the website?
The handout for the social work licensure compact?
Yeah.
I don't know that I have that handout.
I think I sent it to you or sent it to someone, but I can, if anyone needs that, it's like a little fact sheet that you could distribute.
Okay. Yeah, please. Definitely.
Also, could you explain what it means for it to be a bifurcated budget?
That it's going to be passed in 2 parts.
Okay. And do you know like which part would be passed first or?
The first part that's going to be passed is going to be like basic general operational expenses.
Okay.
That's for like state offices, like for them to run personnel to operate day to day, etc. And then the programming portion would be passed in September or later, depending on when or if the federal government gets their stuff together. That's the best way and easiest way I can explain it, layman's terms.
Thank you.
You're welcome.
Hey, Nikki.
Yes.
This is a little unrelated, but when you were talking about social workers and licenses to practice in other states, my association, those of you who don't know me, I work for the Pennsylvania Association of Area Agencies on Aging, and I was hired about 4 years ago to help our AAAs access mental health and substance use disorder services. Anyway, we were approached recently by the Psychological Association. They have a bill that they're working on to allow specially trained, and when I mean specially trained, I mean 2 years in psychopharmacology, that kind of thing, specially trained psychologists to write prescriptions. Do you guys have a position on that?
Yes, last legislative session we fully supported it.
Awesome.
Recognizing again that's going to go a long way
Yes.
to putting a dent in the workforce shortage, because a lot of the calls that we get on the NAMI Keystone helpline involve waiting lists, and
Yep.
We
Yep.
always offer support groups and classes in the meantime while people are sitting on those lists. But yeah,
Wonderful.
that's something we supported last session, and once it gets reintroduced again, I'm totally game for it.
That's fantastic. Super. Thank you.
Absolutely.
Do you think can I ask, what do you think are the chances of that bill, something like that, passing? Because I feel like I feel like that could be an uphill battle to get that one
It
passed because
absolutely.
of our
Well,
clinical medical
it's
providers
primarily
likely
no
being very
question.
protective of their
Exactly.
prescribing
Yep.
powers.
And apparently, Psychological Association has been negotiating with the Psychiatric Society, and they came up with a solution that looked like it was going to go through, and then it fell apart. And it's not just the Psychiatric Society, it's also the American Medical Society that has not been supportive. But apparently psychologists with this special training do have the opportunity to write scripts in 7 other states and in Veterans Affairs in the whole. So we're hoping that some of the other states moving ahead will help, Pennsylvania do better. But Sarah, you're 1000% right. It's going to be an uphill battle to the day it passes, unless. But again, and lots of negotiations are still underway, and hopefully those will break too. It's just so desperately needed. I mean, if we had psychologists that could write scripts, it would be so helpful. And when you hear their argument for it, it's so powerful. So many of them being the psychologists are already trained. They've already, in fact, I was just on a call yesterday with a psychologist that she has a master's in a PhD in psychology and a master's in pharmacotherapy. Am I saying it correctly? Yeah, thanks everybody. And but and what they're saying is that they're currently seeing patients who are being prescribed things that their patients are having trouble with. And so they then have to negotiate with another provider. It's really amazing to hear the whole. And then of course it's nothing but waiting lists if you're trying to see a psychiatrist. And there's so many primary docs. Our complaint is there's so many primary docs out there that are writing psychotropic medications for older adults, and they're not getting the kind of follow-up care they need. And we think psychologists would be more likely to provide that.
Thank you, Lynn. But yeah, Sarah, I would agree with Lynn. That's going to be an uphill battle. I believe if they reintroduce it, it'll be the 3rd session that it's been introduced during. So, I don't know. Sometimes you have to grind it out for longer than necessary, and I really just don't understand why they don't pass these things. I know because lobbyists, etc., but things that would make the world a better place, and they're just so difficult for no reason about everything. Okay, so I'm going to move on. Legislation that was recently introduced, excuse me. So the Medication-Induced Movement Disorders Education Program is to educate people about tardive dyskinesia, and that was introduced by Representative DeLoso. We had our advocacy day on May 6th at the Capitol Rotunda. And after that was all said and done, after our press conference, etc., I had the opportunity to go upstairs and meet with Representative DeLoso and some of Representative Schlossberg's staff, Representative Tara Prost. They did a declaration for Tardive Dyskinesia Awareness Week. As it was that week as well that we were there. So I was excited to see him just do that declaration in general, as well as introduce this piece of legislation. Representative DeLoso does live with tardive dyskinesia because of psychotropic medication. And one of the things he shared with me that I was kind of floored, I don't want to say floored by, because maybe relieved. I don't know how to describe it, but he told me candidly that more than half of the representatives that serve us are on some kind of psychotropic medication for anxiety, for depression, because they can't sleep. He said everybody's doing it, and he's one of the few that's a little bit more open about it than others. So it's always like, again, it's a relief to hear things like that come from somebody's mouth that's in that type of position. So, again, just a candid little moment that we were able to share when I was at the top of the stairs. So I was very excited to see that piece come across my desk. So, also, this is our big push. I sent out an action alert yesterday, not necessarily naming House Bill 1519. Again, got to be careful so we don't accidentally cross over into the lobbying side of things. But yesterday we sent out an action alert, Christine and I, regarding collecting stories for individuals who have had step therapy be a barrier to care. If you don't know what step therapy is, it's the easiest way to put it is you have to try this medication before you try that medication, before you try that medication. And there's also a lot of prior authorization issues that revolve around some psychotropic meds, in particular those ones that are fairly new, that are still under, like, you're not even allowed to make generics for them yet because of the patents, etc. And those are usually the types of medications that doctors don't want to jump directly to because of the cost to them, the cost to the state, the cost to the patient. However, we all know, I'm a product of this myself. There are meds that work for me, there are meds that don't work for me, and why are we going to waste my time on meds that don't work for me and I may have a negative reaction to? I have a whole laundry list of them that's happened with, when we can just get right down to brass tacks and get me on something that we know is going to work for me. So that's kind of the crux of House Bill 1519, and kind of eliminating those barriers, the prior authorization as well as the step therapy. So very happy to be working with several actual lobbyists on that. However, from the advocacy standpoint, that's what we're working on right now, is collecting those stories. This is on miscellaneous further down the agenda, but I'm just going to knock it out right here while we're here talking about it. NAMI Keystone and its partners have been invited to participate in a mental health caucus hearing on June 24th. Katie Morton from the AFTAC, as well as Christine Lederer from our staff, are going to be traveling to Harrisburg and participating in that hearing. And part of that story collection is giving a voice to people who have been there and done that. And we're going to be submitting stories to the official record, as well as Christine and Katie are going to be highlighting some of the quotes that we've received from advocates already. I've already gotten at least 15 emails saying that people are willing to share their stories and have those submitted to the official record. So I'm working on gathering those currently, and that'll be my goal over the next couple days. Again, the hearing is next Tuesday, so a week from today. There's also a Senate dinner the night before that we've been invited to attend, so I'm very thankful. Christine has agreed to go from our staff, and that Katie will be joining her to represent FTAC and all the other agencies that she's involved with. The PBAT, and I can't remember the other one, PMHCC, I think, is so I'm excited about that. So if any of you got that action alert, feel free to send out to your networks. The more information that we go in there with, I think the better off we're going to be. Katie, I see you're off mute.
I was just coming off mute to say yes, it's PMHTC. You got it right. That's
okay,
all.
Awesome. So many acronyms, I can't keep up. Okay, so any questions about those first two bills that we talked about? Okay, so another piece of legislation has been introduced, House Bill 1590, and this falls under the four walls rule. We've been told, when I say we, there's a whole bunch of us that have been told multiple different things, in particular from OMSAS regarding what's happening with the regulations, and this is the legislative body's way of just ensuring that despite what might be happening at the federal level, that they can kind of take measures to curtail the impact that it has on people that live in Pennsylvania. So happy to see that had been introduced and has actually had some movement already. That doesn't happen very often where something is introduced and immediately has some kind of movement. So that was a good thing. So hopefully that's one of those things that we can get passed. Look, there you go, Kim. That's my other one. 1590 for now. Again, it'll go a long way towards, you know, like we said, collaborative care model, all that stuff, getting people off of wait list and the services that they need. So that'll be my second for right now. Okay, next up. So Senate Bill 716, excuse me, I can't talk, is wants to update the Mental Health Procedures Act to recognize substance use disorder and alcohol dependence as mental illnesses, which absolutely should be. However, Christina and I have talked about this. I'm confused as to where they're trying to make that adjustment within the language of the Mental Health Procedures Act, because where it is happening now, it will be done under the AOT section of the Mental Health Procedures Act. And for those of you not already familiar with AOT, Assisted Outpatient Treatment in Pennsylvania, it's optional. And when I say optional, I mean that counties have it's their choice. Do you want to participate in AOT? Do you not want to participate in AOT? I know for sure Allegheny County has recently opted in. I don't know how that's going to go. I don't know what's happening with that. I don't know what's happening with the rollout of that. But I know there have been other counties that have opted in, and then the program doesn't go very well, so they opt back out. But again, as far as I know, there's only the one county that's opting in at this time. So I'm worried about it if it gains traction, but I'm not worried about it because it's in the AOT section. If maybe they're just, I noticed that Representative Schlossberg is co-sponsor on it, so maybe this is the way, and Christina had this thought after we talked, maybe this is their way to open up the Mental Health Procedures Act in general, for some of the changes that we as stakeholders had supplied to his office at the end of last year, with that report he issued earlier this year. So that's kind of where I'm at with it now. Definitely something I've got flagged to keep an eye on for sure. It's important, but I don't understand why they would only change it there, because there's lots of other opportunities within the act to be able to change it. So I'll keep everyone updated. Yes.
My guess is that the drug and alcohol community would likely not be supportive of that. At least, and again, it's been 5 years since I represented drug and alcohol treatment providers, but at RCPA. But back then, I can tell you now, they would have never. I mean, they didn't even want it to be considered a mental health problem, much less there be any kind of. And what we used to always hear, because we represented mental health also, we generally, and I have my own biases. I've been in recovery for 35 years. And what I always heard is, oh, well, you have to have that readiness factor. And in drug and alcohol, if you want somebody to get treatment, but it's really not true. The data, there are lots of folks that are forced into treatment because of a criminal justice involvement. And it can work, if you forcing someone into treatment doesn't always work, but certainly can. Have you heard anything, Nikki, about the drug and alcohol community's response?
No, I have not.
Okay.
I didn't know
I
this
haven't
bill
heard much at
thing
all.
until last week. Again, thank you, Christine, for bringing it to my attention. So I'm not overly familiar other than what I've read so far and been able to offer that. Yes, Jess.
I can say from a lived experience perspective and just talking with, county mental health and folks involved with community support program, I think a lot of the issue of that involuntary commitment is the issue, which is a lot of the reasons too why I think a lot of counties have reported that they're not opting into the AOT part of it. I think from a systemic level, having involuntary commitments for substance use, we're not ready for it. I think that ultimately is the big picture issue that we need to be considering if we're having these discussions about being able to help people and access within our mental health system I mean, ideally, yeah, we'd be able to get everyone off the streets and everyone clean, but I just, I don't think we're ready for it.
I hear you.
I just put in the chat too. It's unofficial, but I heard through some grapevines that DDAP is not a fan of that bill. So just putting that out there too. But I can't say it officially.
And I would guess that just because they're so heavily influenced by, of course, as they should be, the drug and alcohol community. Or I'm not supposed to say that anyway, substance use, abuse and disorder, and whatever the right words are I'm supposed to use today, guys.
I understand Linda's struggle is real. I don't know if I'm accidentally ever inadvertently putting my foot in my mouth, so I just go with what I know and apologize. And hey, if I'm wrong, just correct me, please. That's all I ask. If I'm saying the wrong thing, so I have to keep up with enough stuff on the day to day. I don't have time to keep up with that as well. So if you ever catch me acting a fool or saying something out of the pocket, just let me know. Like, hey, that's not right. So thank you everybody for your feedback on that one. It's going to be an important one, especially to see how it moves forward. Hopefully, based on the feedback that we've gotten today, it doesn't move forward. Because I agree with you, Jessica, the system's not ready for that. We can't even keep up with what we've got happening currently. So adding more stress and strain to that system isn't going to go well at all. So next is the federal updates. I've included the email that goes out to a lot of NAMI folks every Friday afternoon from Stephanie Pasternak. She works at our national office within the advocacy department. And she's been doing these emails for probably like 2-3 months now, easily. And they're a great tool to keep up on what's happening federally. I've included the actual email as an attachment. There's a link there that you can sign up to receive this email. So please, by all means, feel free to do so. There's a lot happened federally, a lot of still unanswered questions, a lot of unknowns as to what's going to transpire in the future, especially given, recent events of the last weekend and things of that nature. So, again, if you're so inclined to do so, please feel free to sign up for Stephanie's email. There's also a monthly call that's happening through NAMI National, where Hannah Wazlowski, she is our lead advocacy person for our national office. Her and her team have done an excellent job in curating these calls and trying to get as many things answered as possible. We just had one yesterday. Unfortunately, due to my schedule, I wasn't able to attend it, so I will be watching that hopefully tomorrow. Again, everything's so busy right now, so I do apologize for that. But the option is there. Feel free to read through that email. Again, I mentioned that everything passed through the House. Nothing's really happened with the big federal bill. I don't even know what it's called. It's like the bigger, better bill or something ridiculous. But yeah, so again, moved through the House. Still not any movement in the Senate, and really kind of hope it stays that way for the time being, or at least they get in there and can work something out, not to the detriment of half the country. So I included again the link for our PA legislative members. Again, I mentioned we're about to go to summer break. It's a great time to get out there and visit. Like I answered Kim's question. Those would be my two big things that I would support right now: the Social Work Licensure Compact, as well as the Four Walls legislation. So on the spot dot right now, those are my two big ones. So if you need more information on either of those bills or anything of that nature, would like to set up, would like help setting up, maybe you want to take a group of advocates and you need some NAMI Smarts trainings, just please let me know. Feel free to reach out at any time. So this is something fun that Christine and I have come up with. We're going to do advocacy capacity building sessions in the near future. And I wanted to put them on the agenda because I want anybody who's on this call to be able to come. If you're in a NAMI leadership position, you've already got this information, or your executive director, chapter president, whomever is at the top should have this information already. But I wanted to be able to open them up to our friends on the policy call as well. So our very first one will be mental health advanced directives and powers of attorney on June 26th at 1 p.m. not here on Good Ring Central. It's actually on Teams. Thank you, Christine. So we'll be having that again from 1 to 3 p.m. on June 26th. And this is just like a general overview of the mental health advanced directives, the parts and pieces, what it does, what it doesn't do, legal parameters surrounding the document, things of that nature. So if you're interested in that, please reach out to me, reach out to Christine Lederer and get yourself on that list, and we'll get you a link for that. Our second one will be Policy Making 101. If you weren't able to attend the conference in May, or maybe you chose to go to another workshop, I'm not mad about it. I promise I'm not. I did a wonderful workshop on Policy Making 101 where I talk about the process at the federal level and I talk about the process at the state level. A lot of them are the same. A lot of the process is the same. Some of it is slightly different. Especially because we're a Commonwealth, so we don't do things like a whole lot of other state legislative bodies do. So I did that at the conference. We're going to be doing that as one of these advocacy capacity building sessions because there's a lot of misunderstanding in what the legislative process is. So doing this workshop and presenting it in this format and giving everybody a chance to ask more detailed questions. We just thought it was a good thing to do. I also, in the workshop, talked about the difference between advocacy and lobbying. And basically, lobbying is nothing to be afraid of. You have to do a lot of very direct, very specific work with the legislative body to get in trouble for lobbying. But I know there's a lot of people that have lots of concerns about that and questions. So that's included in part of the Policy Making 101 too, kind of what you can do and what you can't do within the parameters of the law, especially if you're a nonprofit. So we've got future topics lined up for September: financial planning. October will be housing. In November, we're going to talk about reentry programs. We're working with presenters right now to nail down a date for those. So as we get dates for those, you'll absolutely hear about them. So that's where we're at with all that stuff. Does anybody have any questions, comments, concerns? Did I not give enough detail, too much detail, anything? Okay. Well, there's not a meeting in July. I'm actually going on vacation. I'm getting married in Denver, so I'm pretty pumped about that. So we won't be having a public policy call because I'll be at a concert that day. So and then get married the following day. So I'm excited for that and excited to finally take a vacation. Real quick, just a quick tooting of my own horn. I got picked up to present at the CIT International Conference in Anaheim, California. In August. Myself and Bobby Tanier from Westmoreland County and Tiffany DeMarchi from Westmoreland County and Devin, I don't know how to say Devin's last name. I'm going to say Chianos, from Dauphin County. We're going to be presenting on our CIT for Youth program that we've been going around the state doing. So we've already had 3 this year and we've got 4 more coming out through the rest of the year. So plus this presentation. So it took us a minute to get it off the ground, but we're moving in the right direction with it. So if you're going to be at the CIT International Conference, come say hey. We're presenting Monday morning, I believe. I don't even know what day.
Congratulations. Wow. Congratulations, Nikki. That's wonderful. Much deserved. And it's almost a shame that you have to get married to go on vacation.
I know. Listen,
Speaking as a girl that has no interest in getting married again, you know.